Hey everyone, welcome back to Dr. Halal channel. Today, we talk about a topic that's both important and often misunderstood: acute HIV infection. Let's break down the very first stage of HIV infection, known as acute HIV infection, or sometimes called acute retroviral syndrome. This is the earliest phase after someone contracts HIV, and it's a critical window for both the patient and public health. Think of this stage as the body's immediate alarm system going off after HIV enters the bloodstream. It usually lasts just a few weeks, but it's absolutely crucial in the course of the infection. During acute infection, HIV multiplies at high speed. The virus targets CD4 T cells, which are essential for your immune defense, and causes the viral load to skyrocket. This is when the virus is most active and aggressive. Viral load is the amount of virus in blood. In response, your immune system starts a fierce defense, releasing chemicals and activating cells to fight the invader. This battle is what triggers the symptoms of acute HIV infection, which can range from mild to severe. Please note that not everyone experiences symptoms, and some persons mistake HIV symptoms for a bad cold or the flu. This overlap with common illnesses makes early detection really challenging, and many people don't realize they've been infected. If symptoms do appear, they usually show up 2 to 4 weeks after exposure. People might experience fever, chills, sore throat, swollen glands, muscle aches, or a skin rash. It can feel like the worst flu you've ever had, and sometimes symptoms are so intense that people seek medical help. HIV spreads through certain body fluids: blood, semen, vaginal fluids, rectal fluids, and breast milk. The most common ways people get infected are through unprotected sex, sharing needles, or from mother to child during birth or breastfeeding. During the acute phase, people are most infectious, even if they don't know they have HIV. Recognizing this stage and understanding the risks can help prevent the virus from spreading to others. The good news is that early diagnosis and starting treatment right away can dramatically improve long-term health outcomes. Antiretroviral therapy can lower the viral load, protect the immune system, and reduce the risk of passing HIV to others. Next, let's take a closer look at how and when these symptoms show up, and what you should watch for if you think you've been exposed, and what you should do. Timing is everything with acute HIV infection. Understanding when symptoms appear can make a huge difference in recognizing the infection early and seeking help. The process is often subtle, and many people don't realize what's happening in their bodies until much later. Symptoms don't appear right after exposure. There's an incubation period of about 2 to 4 weeks. This window of time can vary from person to person depending on their immune system and the amount of virus they were exposed to. It's a silent phase where the virus is working behind the scenes. During this time, the virus multiplies rapidly, but you might feel fine. You could be going about your daily routine, seeing friends, working, or exercising with no idea that your body is fighting a new infection. When symptoms hit, they're often mistaken for the flu: fever, sore throat, body aches, and fatigue. Some people might also experience night sweats, headaches, or even a rash. These symptoms can be mild or severe, and they usually come on suddenly. Most people don't connect these symptoms to a risky event weeks earlier, which delays diagnosis. This is the period when HIV is most contagious due to the high viral load. The virus is present in large amounts in the blood and other bodily fluids, making it much easier to pass on to others without even knowing it. If someone continues unprotected sex during this time, the risk of transmission is very high. Even a single sexual meeting can be enough to spread the virus, especially when neither partner is aware of the infection. Symptoms usually last 1 to 2 weeks, then fade as the immune system regains some control. You might start to feel better and assume it was just a passing illness, but the virus remains active in your body. Afterward, people enter the chronic phase, often feeling healthy while the virus quietly damages the immune system. This stage can last for years without obvious symptoms, making regular testing crucial. This deceptive calm is why early testing is so important. Only a blood test can confirm HIV infection during this stage, even if you feel perfectly fine. Don't ignore severe flu-like symptoms after a high-risk exposure. If you think you might have been exposed, ask about getting tested. By recognizing the signs and acting quickly by testing, you can protect yourself and others. Next, let's talk about a key symptom, which is swollen lymph nodes, and why they matter in early HIV infection. Swollen lymph nodes, lymphadenopathy, are a classic sign of acute HIV. Lymph nodes in your neck, armpits, and groin swell as your immune system fights the virus. Unlike a cold, HIV can cause widespread tender swelling in multiple areas at once. Imagine waking up with sore lumps in your neck and armpits. This is your immune system working. The context matters. If you have these symptoms after a high-risk event, it's a red flag. Swollen nodes plus fever, fatigue, and rash should prompt immediate medical attention and testing. Doctors use the pattern and location of swollen nodes to decide if HIV testing is needed. Now let's look at another visible clue, the HIV rash. The HIV rash is another common symptom in the acute phase. It's usually a collection of small reddish or dark rash on the chest, back, face, or limbs. Unlike most rashes, it's often not itchy and appears a few days after fever and fatigue start. Many mistake it for an allergic reaction or heat rash, but its timing and lack of itchiness set it apart. If you notice a non-itchy rash with severe flu-like symptoms after a risky encounter, don't ignore it. The rash usually fades in a week or two as the acute phase ends. Remember, a rash alone without testing isn't enough for diagnosis, but in context, it's a key clue. Next, let's talk about how HIV affects your gut. Acute HIV often causes persistent watery diarrhea, much more than a simple stomach bug. The virus attacks the gut's immune tissue, disrupting normal absorption and causing diarrhea. This can be accompanied by nausea, vomiting, and loss of appetite, leading to dehydration and weight loss. If you have ongoing diarrhea plus fever, fatigue, or rash after a high-risk exposure, it's time to go for testing. Many people think it's food poisoning, but the timing and combination of symptoms matter. Persistent diarrhea, especially with other acute symptoms, is a warning sign. Let's see why your recent history is so important for diagnosis. Here's how doctors connect the dots. The key to diagnosing acute HIV is linking your symptoms to recent history of exposure. This connection is often the missing piece that helps doctors recognize what's really going on, especially when the symptoms themselves are vague. Fever, fatigue, rash, swollen glands, and diarrhea are common in many illnesses. These symptoms can easily be mistaken for the flu, a stomach bug, or even stress. But when they appear together, especially if they're more severe than usual, it's important to pause and think about what might have triggered them. What makes these symptoms suspicious is their timing after a high-risk event, like unprotected sex, sharing needles, or any situation where you might have been exposed to HIV. The window of a few days to a few weeks after such an exposure is when acute HIV symptoms are most likely to show up. Without this context, the diagnosis can be missed. Even the best doctors can overlook HIV if they don't know about your recent risks, because the symptoms are so non-specific. Always ask yourself, have I had any risky exposures in the last month? Think about any situations that might have put you at risk, even if they seemed minor at the time. If the answer is yes, get tested. Early testing can make a huge difference, both for your own health and for protecting others. Your history turns vague symptoms into a clear reason for action. It helps your doctor connect the dots and ensures you get the right care at the right time. Don't let embarrassment keep you from sharing important details. Your honesty could be life-saving, and your doctor is there to support you, not to judge. Now let's talk about what to do next. If you develop severe flu-like symptoms, fever, rash, swollen nodes, or diarrhea, within weeks of a high-risk exposure, don't wait. Early diagnosis is important for your health and for preventing transmission to others. Early tests like HIV RNA or fourth-generation antigen antibody tests can catch infection before standard antibody tests turn positive. Starting treatment early leads to better long-term outcomes and reduces the risk of spreading HIV. Don't let fear or stigma stop you from getting tested. Protect yourself and others. Get tested if you're at risk. If you found this video useful, give it a like and share with your friends. Stay safe and see you in the next video.